Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. We invite you to take charge of your health this month by registering for one or more of our virtual health and wellness classes. Coming up, we've got Aging Mastery, Journey to Wellness, our new 24/7 Dad program, and Check Change Control, which is a hypertension management program. All of these offerings are currently happening for the community free of charge. So please visit our website at caahealth.org to sign up for our weekly e-blast, to learn about events, educational offerings, and resources. As we wait for a few more people to join, I'd like to introduce myself and tell you a little bit more about the center. My name is Deidre Johnson, and I am the CEO and Executive Director of the Center for African American Health. For those of you who may be unfamiliar with our work, we have been serving the Metro Denver community for more than 20 years with a focus and commitment to improving the health and well-being of the Black community. As we move through today's session, please feel free to type your questions in the chat and we will address them if time permits. So this time last year, due to the pandemic, we were vigilant, hyper-vigilant about personal hygiene, practicing social distancing, avoiding events with large gatherings, and wearing masks. As a result, flu cases dropped to historically low levels. However, with loosened COVID-19 restrictions and flu season among us, experts warn of a twindemic as we approach the months ahead. Vaccines are recommended as usual, but many of us are wondering how this will affect the COVID-19 vaccine and the recently approved booster shot. Joining me today is Dr. April Randhawa. She is a senior staff scientist at Fred Hutch and Associate Director of Lab Science for the COVID-19 Prevention Network. Dr. Randhawa is part of a team of scientists at Fred Hutch that have been working with many of the COVID-19 vaccine developers to harmonize the design and execution of the clinical trials. Thank you so much for joining us today.
Thank you so much for having me. I'm really excited to speak with you today.
So we know there've been a lot of new developments on the COVID-19 front, specifically the booster shot. I'm really excited to have you here today to lend your credible expertise to the subject, help us dispel some myths, and provide resources to our community. And so before we jump into the Q&A, please explain your work and professional background.
Sure. So my education and training is in infectious disease biology. And before the emergence of COVID-19, my research was focused on evaluating vaccines for HIV and tuberculosis or TB. And although I'm a biologist by training, I've always had a passion for science communication, health education, and advocacy. And I make it a priority to stay engaged with communities, especially minoritized groups, those who've been historically excluded from research and science, and communities that are most impacted by infectious disease. So, one of my goals is to make science more accessible for all. So that's partly why I'm so honored to be with you all today for this discussion.
Thank you. So we'll start with the basics. What is a booster shot and why do we need one?
So vaccines teach our own immune system how to fight diseases, and the immune response that our bodies produce after certain types of vaccine can start to decline or wane over time. So we sometimes need to get a refresher or an additional dose to get that level of protection back up. So for example, there's a booster shot is required for the tetanus vaccine every 10 years for adults. So the first doses that you may have received are what we call the primary series, which create that initial immune response or protection in a person who's never been immunized before. And boosters replace those defenses when they've started to fade. So for COVID-19, I know that we've been hearing so much about boosters in the last month or two, but it's not a new idea. In fact, from the time these vaccines were being developed, scientists have acknowledged that boosters may someday be needed because we just haven't had them around long enough to know how long that protective immunity lasts.
So who should get a COVID-19 booster shot?
So this is changing rapidly, and so I'll talk about the CDC recommendations as of today, October 14, 2021. And so as of now, boosters are only recommended for some people. That is, people who received the Pfizer-BioNTech vaccine, who completed that initial series of vaccines at least 6 months ago and are over 65, who are adults who live in long-term care settings, who have underlying medical conditions like hypertension, other heart conditions or certain cancers, lung disease, diabetes, or adults who live or work in high-risk settings such as healthcare workers, people in correctional facilities or shelters for the unhoused. So I mentioned this is information current as of today, and these recommendations were based on data that were collected from measuring immune responses in people who received 2 doses of the Pfizer vaccine. So after 6 months, they're starting to see some decline of that. So right now it's approved for people who received Pfizer and in those categories I mentioned, but you can expect that the FDA and CDC will be revising and expanding the recommendations based on the review and analysis that they're continuing to do of ongoing research. In fact, just in the last day or two, there's been new data emerging that will help those agencies determine when and if additional shots are needed for people who received Moderna or the Johnson & Johnson or Janssen vaccine. So we'll be hearing a lot more about booster recommendations over the coming days and weeks.
So what's the difference between getting a third COVID shot recommended for immunocompromised people and getting a booster?
Great question. There is a technical distinction between the terms third dose and booster. We use the term third dose when referring to people with compromised immune systems who may not have gotten the level of protection they need from their first doses. So for them, the third dose provides that level of immunity. So in August, the FDA approved a third dose of the Pfizer or Moderna vaccine for people who are immune compromised. So that includes people with conditions that give them a reduced ability to fight infections and other diseases, or if they're taking medications that dampen their immune response. For example, I have an autoimmune disease that requires me to take medication that dampens my immune response. So for that reason, I received a third dose of the COVID-19 vaccine. And for me and others, that extra dose isn't considered a booster. It's considered part of that initial primary immunization series.
And if you're unsure whether or not you might need a third dose,
yeah, I would definitely recommend talking to your medical providers, and they'll understand based on your medical history and the medications that you are on whether or not you need to get a third dose.
So does the booster shot have to be the same brand as the first vaccine an individual received?
It's a great question. Today, as of today, the boosters are recommended for the groups I mentioned for people who received Pfizer, and they would be boosted with the same type of vaccine, so they would get a Pfizer booster. But there's a lot of emerging data from what we call these mix and match approaches. So for example, I think yesterday or this morning, I think is when I heard the news and looked up the publication, but there's some new data that shows that for people who received the Johnson & Johnson vaccine, an mRNA booster that is Pfizer or Moderna may provide the best protection. So although these are just like emerging data, they have to be reviewed and evaluated, and those data will inform the recommendations we'll start to see evolving in the coming weeks and months.
Do you know when the Moderna vaccine or information regarding it will be available?
I expect it to see more information about that in the next week or so. That the FDA is currently reviewing the data on boosters for people who received the Moderna vaccine.
When is the ideal time to get a flu shot, and how will the timing affect the COVID vaccine?
So we're now entering flu season in the US, so the best time to get a flu shot is as soon as you can. And there have been studies done, and the CDC does say that the flu and COVID-19 vaccines can be administered at the same visit. And a lot of, there are some reasons to do that. You don't have to go in twice. You don't have to, if you're not out and about or working in a healthcare setting, you don't have to put yourself, at risk more than once if you get them at the same time. There's no safety concerns about that. When I received my third dose about a month ago, I received my flu shot on the same day. I got them in separate arms. That's not necessarily required, but I did that. And I'm encouraging my family and friends to book their flu shot appointments as soon as they can, just to get ahead of that, the flu season.
So it's interesting. So if you're somebody who knows that you need a booster, if you know you need the third shot because of your immunity system, do you no longer need to think about a booster later on?
I think that right now the recommendations are, because it's based on whether you mount an initial immune response or not. So it may come out that, we all need to get annual boosters or something. So that might be the same for everybody. But right now, why they are recommending the third dose for people who are immune compromised is because those of us who have those conditions or take those medications that dampen our immune response, we never mounted that initial protective response as much. So we had to get an extra dose.
Okay, so that you have that full primary.
Exactly.
Response. Okay. What about individuals who are planning to have a family? Does the vaccine affect fertility in any way?
So this question is something we've been hearing a lot ever since the vaccines were first authorized. And I certainly understand why folks would be concerned about long-term impacts. However, there's no evidence or that any vaccines, including COVID-19 vaccines, can impact fertility. Becoming severely ill from COVID-19, however, does have the potential to impact fertility and the health of a pregnancy in someone who's infected with the virus.
What advice can you offer to individuals who may still be on the fence about getting the vaccine and are hesitant?
Yeah, thank you for this question, because I know we've been discussing boosters for the first part of this so far, but our main goal right now is still to get everyone vaccinated with that primary series. Vaccinating the unvaccinated has to be the top priority even over booster shots. So that goes for people in our regions here in the US that have been unable or unwilling to get the vaccine, and also for people in places throughout the world who have limited access to vaccines. We've been doing pretty well over the past few months in ensuring that everyone's getting vaccinated, but there's still a way to go. I know that most of the community you serve is in the Colorado region, so I was looking earlier this week at some data from the University of Colorado. And in Colorado, there's still about a quarter of the population, almost 25%, that's still not fully immunized. So, we've seen there and in other parts of the country and the world that hospitalizations are rising again. In Colorado, the daily average is around 900 hospitalizations. So those are people with very severe illness due to this virus. And that's one of the highest rates of hospitalization since the start of the pandemic. Nearly 90% of those people hospitalized are unvaccinated. And for people who are in intensive care units or ICUs, more than 95% of them are unvaccinated. So we know that the vaccines work, and there's still a ways to go to get everyone vaccinated. So I think of the remaining challenges kind of twofold. One, there are still some issues with access in certain regions, but I feel like major strides have been made in that area. So community organizers, activists, healthcare workers have been working really hard over the past year to eliminate barriers to getting information about where to get vaccinated, booking appointments, getting to appointments. I know that there's probably still some people that face those challenges and barriers, so we have to continue to making trying to eliminate those by, providing time off to get vaccinated, providing childcare if needed. But the other huge component of this is hesitancy. And most of that is citing safety concerns. I know that my colleague, Dr. Stefan Wallace, joined you all earlier this year, and he spoke about the various layers of safety reviews that occurred during the development of these vaccines, including data safety monitoring boards that are independent from the vaccine developers, panels of experts from various communities, various levels of safety reviews during the development of the vaccines. But that was back in February. Since then, nearly 4 billion people worldwide have been vaccinated. So that's more than 6 billion shots administered. We have a lot of data now about the real world safety of these vaccines, and they're still proving to be very safe and effective. But of course, as with any intervention, there are some rare side effects. And although the risk of those is really low, I have to acknowledge that any risk is scary for people. And these rare side effects that have been identified with the COVID vaccines have to also be weighed against the known much higher risks from contracting COVID, right? We know that COVID can cause severe illness, hospitalization, even death. And many of us know firsthand the devastation this virus can cause. And then on the other hand, we know that there's many people that seem to recover very quickly. And so people are often, wondering, well, if I'm young and relatively healthy, maybe I'll just recover quickly. But it's important to understand that even those that recover quickly, many of them are experiencing long-term effects, and we don't know how long those will last or what other types of long-term complications may arise. So to me, I feel like it's COVID infection. It's the growing evidence of persistent symptoms from what's been come to be known as long COVID that are the more troubling unknowns out there. I feel like there are very few unknowns when it comes to the vaccines, but a lot of remaining unknowns when it comes to the disease. So, many people do have fair and reasonable questions that I think can be answered with evidence, with real world data. But besides these reasonable concerns and questions, we also have to acknowledge the hoaxes and active disinformation campaigns that are, I think, taking advantage of people's real fears and concerns. We can try to refute that disinformation with science and evidence, but I feel like it has to start with listening. So, to your communities you work with and people who are watching today, I definitely want to say, if you know people who are hesitant, the most important thing is to listen to them, to not dismiss them or downplay concerns of our community members. We have to listen, because I think the big source of the distrust in the vaccine and the public health system in general is a result of feeling silenced or not heard or excluded and outright ignored in the past. So breaking down that mistrust, re-engaging people who are hesitant to get the vaccine, it's not going to happen by dismissing them or talking at them. Instead, I feel like we need to listen and engage with humility and compassion. And a lot of people are really focused on personal choice, and it's true that the choice to get vaccinated is a personal choice, but it's a personal choice that affects the health and well-being of everyone. So I guess that was a long answer to your question, but to summarize that, I strongly feel that vaccination is the most important and life-saving tool we have in this pandemic. And we're fortunate in this part of the world to have access to vaccines that have been proven safe and effective. So we need to reach out to and listen to the people who still have concerns so we can help answer their questions.
Thank you so much for that answer. And thank you for helping us answer questions, which is what a part of this series has always been about. So before we take some questions that have come in, Dr. Randhawa, please briefly explain some of the resources you provided for us to share today.
Sure. So I've shared a few links, including a link to the research that's going on at Fred Hutch in my organization on COVID-19. A lot of that has been related to the development of these vaccines and the ongoing evaluation of them, but there are some researchers also looking at treatments. I've also provided links to our COVID-19 Prevention Network website and some resources that we've provided in our community here in Washington, but that I think are relevant to anyone for as far as, looking at safety of the data, answering some frequently answered questions, getting links to other resources as well.
Thank you. Really throughout this whole 18-month journey, your organization has been so helpful. There have been a couple times where I've actually sent Dr. Wallace an emergency email. I have the following question, and he's always responded.
That's wonderful to hear.
Let's take a few questions that have come up. Sure. The first one, is there any idea of how often the population will be recommended to take a booster shot for COVID-19 next year in 2023?
Yeah, great question. And I can't answer that because we don't have that long-term data to see how long immunity lasts. We're starting to get more and more of that, but the data that we do have is kind of in the context of how the pandemic has evolved to date. As things change, as hopefully rates of infection start to decline, it may be less important to have as frequent boosters. If there still remains to be like ongoing community transmission around the world, and that is possible for a few years, especially because not everyone around the world has access to vaccines, then we might be looking at something more similar to like the flu shot with annual vaccination. So it's kind of all speculation right now. I can't answer that absolutely, but we are learning more as things evolve.
Thank you. What are the side effects people may experience with the booster shots? Are they similar to the first shots?
Yeah, absolutely. They are similar to the first shots, and these are, most of them are pretty mild, like arm soreness. You might get a headache or feeling tired or feeling like you have a cold or flu. Some people even get some fever. It's less common to have allergy or more severe impact, like severe responses, but I do think that it seems like most people who are getting the booster so far are either experiencing similar side effects that they experience after their second dose, or less. And that's anecdotal evidence right now. There haven't been enough data collected and analyzed to say that absolutely. But I would expect something as similar to what you experience after your first doses.
And then I know after the first 2 doses, they always tell you to give yourself a couple of weeks for it to kick in. Is that the same thing for the booster?
Yes. So when you whether you are exposed to a virus or bacteria or a vaccine, your immune system takes a couple of weeks to just fully mount that response. So you're not considered fully immunized until about 2 weeks after that last dose.
Okay. What percentage of the population needs to be vaccinated to achieve herd immunity?
This is a common question we get too, and there's no magical answer to that for many reasons. But one is the variability in how much transmission we see going on in the community. We can see herd immunity for pathogens that have been mostly eradicated by having 80% or more than that people vaccinated, because there isn't like ongoing transmission. But because people around the world have less access to vaccine, and we have global travel and a global community, I think it's gonna take longer to get the overall transmission rates down. So there's no magic number answer to that. Sorry to say.
If people don't take the booster, how could this impact the status of the pandemic in the US?
That's to be determined, because we know that although immunity is waning over time, it's not completely gone. So you still have some level of protection, especially against severe illness or disease. I think we need more time to look at data and collect data from people who have been boosted to fully answer that.
This next question, you actually touched upon it a bit, but mandates to be vaccinated are being made nationwide and in different areas of life, schools, healthcare, and social places. Do you have any insights on this topic as it relates regarding the balance between public health and individual freedom?
Yeah. I think any thoughts I can share are kind of just personal feelings, and we live in a global community, and infectious disease is always going to be around. But in order to really bring down the levels of transmission, vaccination is so important. And when you're in a position where you're interacting with the public, I feel you have a responsibility to prevent transmission of a virus that may not be that harmful in you, and maybe you have a mild disease, but could be very, very harmful in someone else. We know there's still a huge part of the population that hasn't been vaccinated, not just because they haven't had access or are hesitant, but children. It hasn't been authorized for use in young kids yet. So kids can get very sick, especially if they have certain health conditions. So I feel like as part of a global community, it's our responsibility to take care of each other. And if a vaccine is shown to be safe, then I feel like it's our responsibility to get that vaccine to not only protect ourselves and our families, but our communities at large.
Any thoughts on the timeline that we'll hear about the availability for vaccines for 5 and up?
Yeah, I think that the FDA is reviewing those data, and we should know something in the next couple of weeks as far as recommendations. And I think that's just first for for Pfizer, and then other developers may also submit applications for approval for younger kids.
Okay.
I know a lot of parents are really holding their breath waiting for that.
Yes. So personal question. So I had Moderna, and it's interesting, when I last went to my doctor, she said I could feel free to get a Pfizer. And
For a boost, you mean?
for a booster.
Yeah. So those two vaccines are very, very similar.
Okay.
There are just a few differences in them, and many places around the world have been doing that kind of mix and match approach. And just based on what's been available. For example, I have family in Canada, and they had less availability early on, so a lot of people got a different vaccine from their initial dose for their second dose. And as I mentioned earlier, there's some data that just came out from a study that looked at this, that was funded by the National Institutes of Health, and they did see some really great responses. And one of the most important findings from that study was for people who got the Johnson & Johnson vaccine, that getting one of the RNA vaccines as your second dose provides the much better protection than a second dose of the Johnson & Johnson vaccine. So it's been done in millions of people, so I don't think there are as many safety concerns. But of course, when we don't have these as large studies as we had for the individual vaccines, and so it's important to collect as much data as possible and look at that very carefully before kind of putting out more wide-reaching recommendations.
Well, we are out of time. I want to thank you for joining me today, Dr. Randhawa. And I really thank you for what you do. It was great that you started out, here's the status of the world as of October 14th, because it could be very different next week. But we really thank you for the work that you do, and hope that you'll come back to give us yet another update in the future as things unfold.
I would love to. I know that there's going to be a lot of new information coming out in the next couple of months, so I want to make sure that folks have opportunities to to ask questions. And thank you for the opportunity to join you all today.
Well, this video will be available along with other information on our website at caahealth.org. Thank you again for joining us today, and we'll see you soon with another important topic to community.